table. We pull them on in. You're going to help get them on. You're going to back the stretcher over here. Always make sure it's locked down. And again, when they do this, we're going to come over here. So, scoot your honey on over here. So they come on over. You try to make sure you get their gowns out from underneath them because they will wrap up like a burrito. You always want to make sure the table's pushed that way. As far over as it can. Like I said, lock down, it's not freestanding. Patient comes over on a warm blanket, towel, not on this, and we cover them up. So then I have my pack. I just opened it. It's all put together. So make sure it goes away from you because I'm leaning over the non-sterile, area. Then you want it to come towards you. You're going to take your edges, come around.
Okay.
Whoop. And I'll have to come back out. Come around. So then I want to drop my sheath. I'm going to get my gloves. I'm going to get the doctor's gloves. We're going to have a pile of probably stuff to drop. 035 wire should come in there, but if not, you grabbing it, check your 035. Make sure it's an 035 wire. And again, you should always check your expiration dates too, which we know is expired. Catheter, again, circulator can open it, whoever, I showed y'all how to open one. I'm going to pretend that I'm opening it, and you're going to have several. So I just opened, dropped that, so I think I'm good. So now I'm going out, wash my hands, coming in.
She like, all right now. YouTube's playing my leg.
Sometimes you won't have it all twisted, that's okay. Here's what you got. And do try to be careful, make sure you get your whites all over there. Alright. So it takes me a minute. I always make my table the same. Emergency. It's quick, I don't have to think about it. Gloves up underneath here for me and the doctor. Try to utilize because a lot of times it's a bunch. Open what you got, lots of trash. I don't know what these little suckers are for, but it's going to be my lighting cane. The manifold that comes in a package that you'll end up opening. Lots of them. Compromise. I just opened up a radial sheath right away. How do I know that it's radial sheath? Because it comes with a micro wire and a smaller needle. Regular needles do not go through the radial. So you'll have to have a micro wire. If you're going radial, there's a different way of prepping it. That will definitely show you.
What gauge is that one?
The needle.
Yeah.
So you try to look it up and see. I know 18, but you can see how small. It may still be 18, just the length is not. The length is a lot shorter. Okay, so I'm still, by the time I'll, my saline, I've got that.
Sure am cold over here.
No, he's still coming. So now, what you do want to do,
Machine above my head.
throw my extra stuff in that I don't use. Usually this is down here, out of the way. Got my needle. Just extra. You may have a lot of extra needles. Sort through. Make sure that you put them on the. You don't know what I'm fixing to do. So. Just see which needles it's actually, because I don't want to use that thick one. Alright, so pretty much happy with my needles selection. It's a lidocaine. Should use that one. There's some extra syringes. I don't know about that. If you get a lot of extras, it's okay. Just throw it over there. So now, you know, I have plenty of time to sort a little bit. Nurse, you mind? She'll fold the blanket down. So now my patient is pop your little prep, clean it. It's just me. Lean over, I'm short. Be careful coming around and clean this area really good. Thanks, James. It's messy. Throw that out. Don't reuse it. Don't put it back on your table. Throw out the claw prep. So it dries a little bit. Oh my goodness, my pad didn't come with a drape. I need a drape. My circulator, please. So it's fine. I use your steam here. Make sure you're not touching anything. Stay sterile.
Like throw it out.
It throws out. Do not put it back on here because it's not sterile anymore once I touched this right area. And plus, usually it's hairy. You can use two, whatever protocol. Thank you. So use my hand because this is a cleaned area. Go for the pulse. I know this is the side he wants to go. You have collars and other things over there, so we'll pull my pole over here. You don't want nothing up underneath it, but if it does, you want to deal with it. I like to use extra clips because sometimes it's heavy weighted. So try to keep the weight off. If I cannot feel this, and you've already got your lead on, and the nurse is not in the room, or if they have their lead on before the case, you can take your hemostats, place it, go up under, get a little fluoro, come back, and you want to be right there near the head, because sometimes the head will be a little farther up than where it's located. But again, you've prepped a good area, so if he moves it, you're good. Usually it's where the poles. So I'm going to set. I'm a towel hog. A lot of people don't use so many towels, but I do. So I need to get my lidocaine. 2%, 1% lidocaine. I always put my containers near the edge, so if the nurse comes up, she can pour it. She's telling me 2%. So I am pulling up my lidocaine. Get the air out of it. Pulling up my lidocaine. That was lidocaine. So then I get my hybridized saline. I do flush the needle. My doctor some 4x4s. He might not like it. He might try to go ahead and get his lidocaine. Small. See now I do have a small needle, larger needle. Topical. He's going to poke. Give it time. We hope. Then go deeper. When the doctor's done, always make sure you put a back in your sharps. So any extra sharps, be very cautious because again, this is you. So my Hypernice saline, I've got, mine's going to be in a bowl. Some of y'all will have it off of a extra bag or however they want to do it. So I've labeled all my syringes. My doctor up. I'm flushing.
One is going to be your
I'm flushing
topical
my
and another
wire.
one going to be the IUs for the
The smaller one's the topical, it goes less deep or whatever.
Flush your wire.
Plus your sheet.
Flush your sheath. Again, the cap comes. Get more saline. Flush the side port. Flush, 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 flush. It's coming out. As I'm flushing, I turn it off. Make sure it snaps in there. And again, I set my doctor and try to get that to the edge. Use your wet 4x4s if need be. Manifold. And a pole. I think here is what they like to do at the medical centers. How to do it. Stretcher. Tubing on out. If not, you're going to have a mess.
So once you toss that across, does your circulator then hook up or you hook up?
No, you're sterile.
Your circulator.
If they don't and you have time and you're fixing a brake scrub, take put on your lens, you can turn around and do it. Just know that you're not prepped. That was what? Is he hooking that to?
Contrast.
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 So you're going to go, what, contrast,
Saline.
saline.
And then your transducer. So that's to my circulator. Here, I think the circulators like to tap on it as I push through. Again, I'm at my hospital and I want to have full range of what I need. So what I can do,
Would you bring the bowl over with your Hypernice saline to prep
Put
it?
your bowl and stuff. You're gonna see at the medical center. This is already on, so I'm just gonna outline that.
Oh, if he opens it, you probably could prep it.
She's got water in it.
What?
Well, she's
So stop recording. It's coming up. I'm just doing it. I'm checking.
what?
Okay. I've got more air than I could do, so I'm pushing the air out and pulling more. And then I want to watch my lines to make sure I don't see air bubble. If I'm good, push it out. This is contrast. And saline. They're all four. Maybe it's just one. Again, tap, tap, tap.
Easier now?
So this is saline, so I'm okay to waste. And again, I saw some micro bubbles. Keep seeing micro
Or you're
bubbles.
sailing on the patient.
So the doc would be in by now while you're doing this.
Oh, he can. He can start getting access if he wants. If he wants to come on in, he's ready. Like I've already, and I'll be watching him.
So you need to pull more, you know.
Not a lot of. I think it's because this is used. You get a lot of bubbles if it's used. You normally don't get this many if it's new. But again, you can keep pulling if need be. I'm gonna say because I'll probably never get this micro bubbles out. But if I'm happy with that, then I've got saline. I'm gonna pull up saline, put it out, and I'm gonna cut it on to my transducer. It's gonna come through. It's gonna come up. I want to take something, and I'll take stats if possible. He's using it. I'll take a full thing of saline, tap it a little bit, and push, 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 push. Oops! Look, I'm almost out. Close it off. Get more saline. Make sure you hear it. Push, 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 push hard, and close it off. It's all bubble free, air free.
You toss that back.
This is normally, tossed over there and plugged in, which we don't have a bag. But actually, it's free. So, now that that's done, I will go ahead and put some saline, take this out. I open it up, put it at the patient's heart level, say 0. On the screen, you're going to see this red line going to come up to 0. It should be there. Once it's done,
Unsterile.
And that's unsterile.
actually, your pole's not that far away. It's closer, but you do want to be careful of the pole. But a lot of times this can go over the pole, the other side. It's not so heavy. You want it on you.
She didn't stretch her wires far
The
enough.
pole's connected to the table. So again, I'm ready. This is ready. You know, he's already got the access now. I'm going to flush everything except for my catheter. I've already covered my eyes and everything like that you got to do. And again, now he's got access.
When would you cover the eye and everything? Very beginning?
You can at the beginning, depends on how
And
bad
then
you
set up your table, or?
I like to get this on because as y'all saw me leaning, so that way if I'm leaning over, then I'm okay. If you fumble with it and you take more time, go for it first. However you like to do it. You definitely don't want to be hanging over the doctor doing this. So if you see him, you can cover it real fast. He's done with lidocaine. He may leave it on the table or he may turn around. Whatever. Be careful picking it up. And don't go toward. Technically, you're not supposed to. Let me do this. Technically, you're supposed to do that. I was okay. I like to have control at all times of backing out, watching, and I always covered it. Like if I had this the proper way, the Dina way, you know, I'll do that. So.
Can we do that in the field the Dina way?
However way, you know, you do it, just always be cautious. You don't want to stab your doctor or yourself. He's done, don't get rid of him. Put him aside. He's already got access. He's done this. This is not what I do. But we all know this elevator, he's going to do that. He's going to be opening it. This is going to be on my table. Wet one. And I'm going to do hold. Snag myself when I grasp it. I like to go ahead and put my sharps. I think that medical center they put them all in a bowl and then they get rid of them. This is not going to go on this catheter. Y'all know this is radial. But if something's ever gone on your table and it can't go on there, you got the wrong sheet. Or sometimes these dilators can be bent. So
would you put multiple sheets on your table?
no.
No.
That's radial. I knew when I dropped it because up here. Should this be an arm and he went radial, he would have went that shorter needle. Again, you have an arm board. He's done got did the lidocaine. You only need one lidocaine for that. You won't need that long needle for the radial. You just need the short needle. He's not gonna go that deep. So with that, you don't have to give him 2 lidocaines. You give him 1. He's got coming out. I already have this laid here. Always check it for the soft end. You want to lay the softer end towards him. He's going to pick it up. He may do that. And he's going to put this in. He can take this off at this point. Lay it down and you pick it up. I like to go ahead and just hard. Touch it. Then I would. You've got to put it on this tiny little wire. Leaning over towards the doctor. Once you do that, put it on in, this comes out, the dilator comes out, and you'll do it, and now your catheter can go through. So, this is when you'll have a 260 wire, and a catheter. he's gonna go in, and as he's going in with this, it's not like we're gonna block somebody. They're gonna use a tegaderm too, like a piece of tape to tape that down. Then you go in and stay in ahead. Then you pin it, and he's gonna slide it on in and go up. And then when the time comes, I get my weapon. He's going to connect the manifold catheter, and it's way on up there, it's not down here. And then he's going to pull back to get the air out while he's doing all this thing. You know, you done got your wire and you're getting your table ready. So again, it gets getting quicker once you get it, but at first you're not going to be quick. You're going to be fumbling. Don't get rid of little wires because you never know. Always keep everything. There's a plus, all of them usually come to 035, a short, but with radio we use a 360, but I keep it because you never know. Even though we have access and he's going up, he can get through some of the vessels. So now, or he gets through and he can't get the catheter in or the angle that he needs to go green all of a sudden. So don't be surprised, but you've already prepped it. You're good to go. Now, you need to refill your lidocaines and set up for the green area if you cannot do radio. I just switched it on y'all with radio plus machine. You do need another sheath at that time thrown, and that's when you ask your circulator if they hadn't already thrown you a 6-French sheath or 4-French, whatever they want to do.
How long does it only take to produce?
It takes you longer a lot of times to prep that patient, get your table open, and sometimes their procedure.
I mean, does it like you have a set time?
No, but when you go to Coliseum, David might be timing you.
That just took you 20 minutes.
Yeah, that's what I was saying. It's like 15 minutes for that.
Oh yeah, it's
Is
yeah.
that normal?
To prep my patient and do my table, for a regular standard, yes. Stimming, no. I better kick it into gear. I mean, I'm doing this. Doctor's coming in and he's scrubbing it on me. He can get his own lidocaine. I'm getting ready to prep my manifolds. We're fixing it fast. I'm getting the sheath ready. That in. You know, I'm still having to cover stuff. It's a lot. But by the time you get to that point, you're so comfortable with this that you're good to go. So y'all should be fine. You will go through orientation. You'll be called on stimming with somebody, and you won't be on your own for a while.
Okay, so that's what I say while we're in clinicals. If the stimming does come in, you just step back and watch. Right?
Except your preceptor and how far along are you?
Okay.